Hello everyone, I am Ms. Disha Purohit. I would like to demonstrate mining symbolic rules to explain lung cancer treatments. The goal of this research is to examine the mind logical rules from which true missing facts can be predicted, thereby completing knowledge graphs with accurate predictions that take the ontologies and entailment regimes into account. Our framework is divided into two quadrants. In the first quadrant, the rule mining system generates logical rules by applying the entailment regimes. A smaller subset of the IRAMED project P4 lookat is used for the experimental study. Due to privacy concerns, the P4 lookat knowledge graph cannot be made available as it contains data about lung cancer patients. Therefore, only the mind logical rules over P4 lookat knowledge graph will be made available publicly in our GitHub repository. As you can see, this is a small visual of the lung cancer patient knowledge graph, which is used as a benchmark in the current study. Our approach takes RDFS subproperty of into account for the experiments in the current example to clearly demonstrate the impact of injecting entailment regimes in the mining of logical rules. The inclusion of entailment regimes results in higher metric values and potential true predictions. Increased inferred PCA confidence of a rule, for example, quantifies that the knowledge graph's partial completion by identifying more productive rules. As we can see, we have made the rules available under the rules folder in the GitHub repository. The results of the null hypothesis test that was used to ensure statistical independence between the PCA confidence and inferred PCA confidence matrices is shown here. When semantics are included, the observed difference in the frequency distribution of matrix reveals the possibility of knowledge graphs being completed with true predictions. Moving on further, in the second quadrant, SPARQL queries are used to analyze knowledge graphs in order to demonstrate use cases of clinical guideline violations, identifying data errors, and potential missing relationships in the knowledge graphs. This set of rules are also available under the rules folder in the GitHub repository. Different types of analysis are performed over these rules in order to get meaningful insights from the rules. As you can see, distributions of the PCA confidence over the definitions of distinct head being appearing in the set of rules are given here. Various examples are shown. Exploring this mind logical rules by performing this type of statistical analysis are shown in the Jupyter notebook. There are many examples which are available in the GitHub repository. Further, to validate the analysis of use cases presented in this work, let us look into the few examples of mind logical rules. As we can see, the first example of a rule is if a patient is in stage 4B and has received oncological treatment immunotherapy, it is more likely that the patient has been mutated with the biomarker PDL1. The matrices of this particular rule are stated here. What we can conclude is there are 28 instantiations of the body that are also the instantiations of the head, that is the support of the rule. Using the below mentioned SPARQL queries, we identified that there is one instantiation is identified that does not follow the clinical guidelines. As we can see, the output of this SPARQL query is listed in this blue box on the right-hand side. Further, this particular patient violates the clinical guidelines. So on the right, we can see the clinical guidelines. It says that if a patient is in stage 4 and is being mutated positive for the PDL1 biomarker, then it is most likely that the patient receives immunotherapy treatment. We can see that here the patient has the biomarker EGFR. So potentially it is violating the clinical guidelines. Therefore, we can say that we use logical rules to check if the patients meet the clinical guidelines. Example 2 is to show the errors which can be found from in the data. We have a rule saying if a patient has received oncological treatment neoadjuvant, then it is most likely that the patient also receives the oncological treatment chemotherapy. We can conclude that there are 34 instantiations of the body, which are also instantiations of the head, that is the support of the rule. And using the below mentioned SPARQL queries, we can identify that there was one patient who did not receive chemotherapy treatment. As we can see here, this patient has received chemotherapy drugs, which are carboplatin, plasactacel, and vinorelbine. But when it was recorded, the oncological treatment is not chemotherapy. It was only neoadjuvant and radiotherapy, which states that there is an error in the data. Rule example 3 states that if a patient is in stage 1B, it is most likely that the patient receives oncological surgery lobectomy. Below are the mentioned matrice value. We can see the 80 instantiations of the body are also instantiations of the head. That is, the support is 80. Using the below mentioned SPARQL query, we identified that there are 2 instantiations that are in stage 1B but does not receive lobectomy as a surgery. If we click on the link below, we can see that the stage of the patient is 1B but does not receive the oncological surgery. They said they received surgery, yes, but the oncological surgery is not lobectomy. I'd like to give my acknowledgements. This project is funded by P4Look at and Trust KG project.